Welcome to this episode of the Sparking Discussions about Jaypirca video series. My name is Dr. Alan Skarbnik, and today I'll be discussing the mechanism of action, or MOA, of Jaypirca. In this episode, we'll be discussing the unmet need in relapsed or refractory MCL after covalent BTK inhibitor is no longer an option, and how Jaypirca works differently than covalent BTK inhibitors.
Jaypirca is a kinase inhibitor indicated for the treatment of adult patients with relapsed or refractory mantle cell lymphoma after at least 2 lines of systemic therapy, including a BTK inhibitor. Please refer to the important safety information and the full prescribing information regarding warnings and precautions about the use of Jaypirca, like infections, hemorrhage, cytopenias, atrial fibrillation and atrial flutter, second primary malignancies, hepatotoxicity, including drug-induced liver injury, and embryo-fetal toxicity.
Before we discuss the MOA of Jaypirca, we'll begin with some background. BRUIN tyrosine kinase, or BTK, is part of the B-cell signaling pathway and is required for normal B-cell maturation, proliferation, and survival. In B-cell malignancies like MCL, the signaling pathway is always activated. So when covalent BTK inhibitors were shown to interfere with B-cell growth and proliferation, they had an important impact on the treatment landscape for MCL. However, despite these recent advances in the treatment of MCL, therapeutic options after covalent BTK inhibitor are still limited. In a clinical setting, this means treatment selection is challenging after a patient's disease progresses on a BTKI, and historically, prognosis has been poor for these patients. Let's go into some specifics behind the MOA of Jaypirca to help further illustrate the difference between Jaypirca and covalent BTK inhibitors. I think you'll see a key difference lies in where and how they bind to the BTK protein. Preclinical studies have shown that the approved covalent BTK inhibitors, ibrutinib, acalabrutinib, and zanubrutinib, bind to the ATP binding site and form a covalent bond, that is an irreversible bond, at a cysteine residue called C481. Jaypirca is different. It binds in the ATP pocket, but it doesn't depend on C481. And as you can see, Jaypirca also binds reversibly to the ATP pocket of the BTK protein. Patients who are symptomatic and have progressive disease need a different therapeutic option when treatments are limited. And now we have Jaypirca, a treatment that works differently. I'm looking forward to incorporating Jaypirca into my practice, since it may help address a real clinical need in the relapsed or refractory MCL patient whose disease progresses after prior treatment, including a covalent BTK inhibitor. Jaypirca is different than other FDA-approved BTK inhibitors because it is the first and only approved reversible BTK inhibitor. Thank you for taking the time to learn more about the MOA of Jaypirca. I invite you to share this episode with your peers and continue watching other videos in the series.
Indications and important safety information for Jaypirca, pirtobrutinib. Indications. Jaypirca is indicated for the treatment of adult patients with relapsed or refractory chronic lymphocytic leukemia or small lymphocytic lymphoma who have previously been treated with a covalent BTK inhibitor. Jaypirca is also indicated for the treatment of adult patients with relapsed or refractory mantle cell lymphoma after at least 2 lines of systemic therapy, including a BTK inhibitor. This indication is approved under accelerated approval based on response rate. Continued approval for this indication may be contingent upon verification and description of clinical trial benefit in a confirmatory trial. Important safety information for Jaypirca, pirtobrutinib. Infections. Fatal and serious infections, including bacterial, viral, fungal, and opportunistic infections occurred in Jaypirca-treated patients. Across clinical trials, grade greater than or equal to 3 infections occurred, 25%, most commonly pneumonia, 20%, fatal infections, 5%, sepsis, 6%, and febrile neutropenia, 3.8%, occurred. In patients with CLL, SLL, grade greater than or equal to 3 infections occurred, 32%, with fatal infections occurring in 8%. Opportunistic infections included pneumocystis, Jirovecii pneumonia, and fungal infection. Consider prophylaxis, including vaccinations and antimicrobial prophylaxis, in patients at increased risk for infection, including opportunistic infections. Monitor for signs and symptoms, evaluate, and treat. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Hemorrhage. Fatal and serious hemorrhage has occurred with Jaypirca. Across clinical trials, major hemorrhage, grade greater than or equal to 3 bleeding, or any central nervous system bleeding, occurred 2.6%, including gastrointestinal hemorrhage. Fatal hemorrhage occurred 0.3%. Bleeding of any grade, excluding bruising and petechiae, occurred 16%. Major hemorrhage occurred when taking Jaypirca with 2% and without 0.6% antithrombotic agents. Consider risks/benefits of co-administering antithrombotic agents with Jaypirca. Monitor for signs of bleeding. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Consider withholding Jaypirca 3 to 7 days pre- and post-surgery based on surgery type and bleeding risk. Cytopenias. Jaypirca can cause cytopenias, including neutropenia, thrombocytopenia, and anemia. Across clinical trials, grade 3 or 4 cytopenias, including decreased neutrophils, 27%, decreased platelets, 13%, and decreased hemoglobin, 11%, developed. Grade 4 decreased neutrophils, 15%, and grade 4 decreased platelets, 6%, developed. Monitor complete blood counts regularly. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Cardiac arrhythmias. Cardiac arrhythmias occurred in patients taking Jaypirca. Across clinical trials, atrial fibrillation or flutter were reported in 3.4% of Jaypirca-treated patients, with grade 3 or 4 atrial fibrillation or flutter in 1.6%. Other serious cardiac arrhythmias, such as supraventricular tachycardia and cardiac arrest, occurred 0.4%. Cardiac risk factors, such as hypertension or previous arrhythmias, may increase risk. Monitor and manage signs and symptoms of arrhythmias, e.g., palpitations, dizziness, syncope, dyspnea. Based on severity, reduce dose, temporarily withhold, or permanently discontinue Jaypirca. Second primary malignancies. Across clinical trials, second primary malignancies, including non-skin carcinomas, developed in 9% of Jaypirca-treated patients, most frequently non-melanoma skin cancer, 4.4%. Other second primary malignancies included solid tumors, including genitourinary and breast cancers, and melanoma. Advise patients to use sun protection and monitor for development of second primary malignancies. Hepatotoxicity, including drug-induced liver injury (DILI). Hepatotoxicity, including severe, life-threatening, and potentially fatal cases of DILI, has occurred in patients treated with BTK inhibitors, including Jaypirca. Evaluate bilirubin and transaminases at baseline and throughout Jaypirca treatment. For patients who develop abnormal liver tests after Jaypirca, monitor more frequently for liver test abnormalities and clinical signs and symptoms of hepatic toxicity. If DILI is suspected, withhold Jaypirca. If DILI is confirmed, discontinue Jaypirca. Embryo-fetal toxicity. Jaypirca can cause fetal harm. Administration of pirtobrutinib to pregnant rats caused embryo-fetal toxicity, including embryo-fetal mortality and malformations at maternal exposures, AUC, approximately 3 times the recommended 200 mg per day dose. Advise pregnant women of fetal risk and females of reproductive potential to use effective contraception during treatment and for 1 week after last dose. Adverse reactions, ARs, in patients who received Jaypirca. The most common, greater than or equal to 30%. ARs in the pooled safety population of patients with hematologic malignancies, N equals 704, were decreased neutrophil count, 54%, decreased hemoglobin, 43%, decreased leukocytes, 32%, fatigue, 31%, decreased platelets, 31%, decreased lymphocyte count, 31%, calcium decreased, 30%. Mantle cell lymphoma. Serious ARs occurred in 38% of patients, with pneumonia, 14%, COVID-19, 4.7%, musculoskeletal pain, 3.9%, hemorrhage, 2.3%, pleural effusion, 2.3%, and sepsis, 2.3%, occurring in greater than or equal to 2% of patients. Fatal ARs within 28 days of last dose occurred in 7% of patients, most commonly due to infections, 4.7%, including COVID-19, 3.1% of all patients. Dose modifications and discontinuations due to ARs. Dose reductions in 4.7%, treatment interruption in 32%, and permanent discontinuation of Jaypirca in 9% of patients. Permanent discontinuation in greater than 1% of patients included pneumonia. Most common ARs, greater than or equal to 15%, and select laboratory abnormalities, greater than or equal to 10%. All grades percent, grade 3 to 4%. Hemoglobin decreased, 42, 9. Platelet count decreased, 39, 14. Neutrophil count decreased, 36, 16. Lymphocyte count decreased, 32, 15. Creatinine increased, 30, 1.6. Fatigue, 29, 1.6. Musculoskeletal pain, 27, 3.9. Calcium decreased, 19, 1.6. Diarrhea, 19. Edema, 18, 0.8. Dyspnea, 17, 2.3. AST increased, 17, 1.6. Pneumonia, 16, 14. Bruising, 16. Potassium decreased, 13, 1.6. Sodium decreased, 13. Lipase increased, 12, 4.4. YLT increased, 11, 1.6. Potassium increased, 11, 0.8. Alkaline phosphatase increased, 11. Grade 4 laboratory abnormalities in greater than 5% of patients included neutrophils decreased, 10. Platelets decreased, 7. Lymphocytes decreased, 6. Chronic lymphocytic leukemia/small lymphocytic lymphoma from single-arm and randomized controlled clinical trials. Serious ARs occurred in 47 to 56% of patients across clinical trials. Serious ARs in greater than or equal to 5% of patients in the single-arm trial were pneumonia, 18%, COVID-19, 9%, sepsis, 7%, febrile neutropenia, 7%. Serious ARs in greater than or equal to 3% of patients in the randomized controlled trial were pneumonia, 21%, COVID-19, 5%, sepsis, 3.4%. Fatal ARs within 28 to 30 days of last Jaypirca dose occurred in 8 to 11% of patients, most commonly due to infections, 7 to 10%, including sepsis, 5%, COVID-19, 2.7 to 5%, and pneumonia, 3.4%. Dose modifications and discontinuations due to ARs. Dose reductions in 3.6 to 10%, treatment interruption in 42 to 51%, and permanent discontinuation of Jaypirca in 9 to 17% of patients. Permanent discontinuation in greater than 1% of patients included second primary malignancy, pneumonia, COVID-19, neutropenia, sepsis, anemia, and cardiac arrhythmias. Most common ARs and select laboratory abnormalities, greater than or equal to 20%. All grades percent, grade 3 to 4%, in a randomized controlled trial. Neutrophil count decreased, 54, 26. Hemoglobin decreased, 45, 10. Platelet count decreased, 37, 17. Pneumonia, 28, 16. YLT increased, 25, 1.8. Creatinine increased, 25. Calcium decreased, 23, 0.9. Sodium decreased, 22, 0.9. Bilirubin increased, 21. 0.9. Upper respiratory tract infections, 21. 0.9. In a single-arm trial, neutrophil count decreased, 63. 45. Hemoglobin decreased, 48. 19. Calcium decreased, 40. 2.8. Fatigue, 36. 2.7. Bruising, 36. Cough, 33. Musculoskeletal pain, 32. 0.9. Platelet count decreased, 30. 15. Sodium decreased, 30. COVID-19, 28. 7. Pneumonia, 27. 16. Diarrhea, 26. Abdominal pain, 25. 2.7. Lymphocyte count decreased, 23. 8. ELT increased, 23. 2.8. AST increased, 23. 1.9. Creatinine increased, 23. Dyspnea, 22. 2.7. Hemorrhage, 22. 2.7. Lipase increased, 21. 7. Alkaline phosphatase increased, 21. Edema, 21. Nausea, 21. Pyrexia, 20. 2.7. Headache, 20. 0.9. Grade 4 laboratory abnormalities in greater than 5% of patients included neutrophils decreased, 23. Drug interactions. Strong CYP3A inhibitors. Concomitant use increased pirtobrutinib systemic exposure, which may increase risk of Jaypirca ARs. Avoid using strong CYP3A inhibitors with Jaypirca. If concomitant use is unavoidable, reduce Jaypirca dose according to approved labeling. Strong or moderate CYP3A inducers. Concomitant use decreased pirtobrutinib systemic exposure, which may reduce Jaypirca efficacy. Avoid using Jaypirca with strong or moderate CYP3A inducers. If concomitant use with moderate CYP3A inducers is unavoidable, increase Jaypirca dose according to approved labeling. Sensitive CYP2C8, CYP2C19, CYP3A, PGP, or BCRP substrates. Use with Jaypirca increase their plasma concentrations, which may increase risk of ARs related to these substrates for drugs sensitive to minimal concentration changes. Follow recommendations for these sensitive substrates in their approved labeling. Use in specific populations. Pregnancy and lactation. Due to potential for Jaypirca to cause fetal harm, verify pregnancy status in females of reproductive potential prior to starting Jaypirca. Presence of pirtobrutinib in human milk is unknown. Advise women to use effective contraception and to not breastfeed while taking Jaypirca and for 1 week after last dose. Geriatric use. In the pooled safety population of patients with hematologic malignancies, patients aged greater than or equal to 65 years experienced higher rates of grade greater than or equal to 3 ARs and serious ARs compared to patients less than 65 years of age. Renal impairment. Because severe renal impairment increases pirtobrutinib exposure, reduce Jaypirca dose in these patients according to approved labeling. Please see prescribing information and patient information for Jaypirca on surrounding page.